Are we in, Candace? Hey.
Hey.
All right. Hey, we are here. Welcome to Below the Skirt with Tamara. My name is Tamara Green. I am a pelvic physical therapist, and I help women overcome uncontrolled bladders, return to that pleasurable sex, and manage pregnancy symptoms so you can become a postpartum champion. So welcome to Below the Skirt with Tamara, and we have a special guest. As we know, to this month of October is Breast Cancer Awareness Month. And I have a special guest. Our guest is Candace Cohen. Welcome, Candace.
Hi.
You look so beautiful. You look beautiful.
Likewise.
Thank you. But just wanted to, this is very dear to my heart. It's dear to my heart because of the fact that breast cancer runs in my family. And I want to thank all the women that are tuning in, right? This is a very pivotal movement just so they can be proactive and just being aware of their bodies. And if there's something that's going on, they can take that step. So I'm going to pass it to you. And I want you to share with them your story, because we're going to then talk about how we connect physical therapy after the treatments of breast cancer. So tell us your story about how you got to this point. How were you diagnosed with breast cancer?
Man, I'll tell you, between being a mom of 3 small children and also managing a business, my health was on the back burner. Self-care just in general, just back burnered. And right after I had my son, I nursed all 3 of my children. So after I had my son, and when I stopped breastfeeding, it's just kind of normal, of course, to still have milk, right? Well, my right breast, the milk, drew up, right? But then the left breast, I thought, oh man, I have a pretty nice storage here. I'm like, it just keeps going. And I'm just thinking, man, I just got milk for days. I need to donate some milk. Right. But, after a year, what looked like milk turned into what looked like colostrum, and what looked like eventually like super dark, blood even at sometimes, that I even brought to my doctor's attention a couple times. And, oh, if you're nursing, it could just be how your son is latching on incorrect, latching. And I'm like, well, I did this 3 times. I think I have a hang on it. Anywho, it turned into just discoloration, like really, really dark, leakage. Just, it was so super weird. It wasn't until I was working in New York one weekend, or when, I don't even remember if it was in the middle of the week or what, but my breast had ended up leaking pretty badly. It was just beyond normal, and it was very dark. And so I went to the doctor about it, because I honestly just thought, man, maybe I thought my milk ducts were like clogged or something. I thought maybe, I just need an antibiotic or something, and they'll send me home. So I went to the doctor. He ordered just a regular mammogram, and I had to go see my OBGYN. When she looked at it, she said, oh no, you have the wrong mammogram. You need a diagnostic mammogram. Like, we really need to just look at this, because it's just not normal. Your son's 2, and we just need to look a little bit deeper into this. Long story short, I went in for the mammogram. I honestly woke up that day just thinking, it's just some kind of an infection. I didn't know what it was. I definitely did not think that it was breast cancer, because I'm like, I'm only 31. It's not breast cancer. I'm not even worried about that. So what turned into, I guess, what should have been about an hour appointment turned into me being at the hospital for like 5 hours. Just a regular exam turned into, let's look at your left breast again. Okay, now let's do an ultrasound. Then it turned into, okay, we just want to biopsy a couple sections. We got to put markers in here. And I'm like, what are they doing all this stuff for? Wow. And then eventually they told me, we're pretty certain what we're looking at is breast cancer. And I'm like, I didn't know how really to react. I did cry for a moment. And when I say a moment, I would say like 30 seconds. I remember taking a deep breath. And I'm like, man, like, I have 3 children, and I'm just like only 31. I just could not believe it. But I got myself together. I called my parents and they came to the hospital right away. They were probably more upset than I was at this point.
Right.
So it was just, there's a lot more to the story I'm sure we'll dive into here on this call, but it was a lot for a 31-year-old to take in with small children. Also, 2 weeks before finalizing a divorce was very dramatic. It was just a lot. It was a lot to take in at that time.
Girl, listen, I do not want to walk in your shoes, but I commend you for your strength and everything that went through. And I just in case, just so we can highlight some big things before we go on to the next component. You are 31. You've had 3 children. This happened during a time of a divorce.
Yes.
And what the typical thing is they teach us is, and as I teach women as well, is, doing your self checks every month, same time, same place, going around your breast, around your nipple, giving it that extra squeeze to see if there's any residual liquid that is coming out, checking underneath the armpit to get all of those areas. All of that. And the crazy part is yours was not what we typically see. You did have the leakage, but it was during a pivotal time when you just had a baby. And I know when I nursed, I still leaked for a little bit of time afterwards. Yes. So that is something big. So for the take home just under that part is for postpartum moms. If you are breastfeeding and you're noticing maybe a discoloration or the leakage is either getting more than the other breast, again, we always look at symmetry. If something is doing one, but is not doing it on the other, assess. And another take home from this is if you feel like something is not right, you don't stop there, right? And you didn't stop. You went and you told your doctor, but it still was not taken to the next step. So I think those are some key things to pay attention to. So tell us your treatment, if you could tell us about that.
Yeah. And I want to tell you about the treatment, but I do want to just let you know, a lot of women look for lumps when they're doing their breast checks because I was an early bloomer. So my mom taught us about the breast check. I think I was learning that since I was about 9 or 10, Right. And so I didn't have any lumps present, but when they went in for the biopsy, they actually found about 6 tumors, kind of like skipped upon my left breast. So
wow.
I didn't feel it. It, wasn't like one big lump, which most women will have that presented, but I didn't. But in terms of treatment, so of course, the very next question that I did ask was, okay, I'm like, okay, so what's next? Like, what do we have to do? How does this work? I'm just, so what we did chemotherapy treatment, which to me was the hardest part, because I really could not, I had to put myself in a mental place, like zone when I'd go in for chemo treatments. I could not stand the smell of the treatments. I couldn't take the taste that it would give me in my mouth. I remember one day I woke up, my entire mouth inside was like black. My tongue, my gums, everything was dark. My hands were super, super dark. Just so many changes happened because of chemo. In fact, she's 9 now, but my daughter and I sat there and pulled the rest of my hair out when all of it fell out. My brother-in-law came and shaved the rest of it off for me. I just, in terms of treatment, I'll stay focused, but I did try to stay positive through chemo because to me, that was the toughest part. Like before I would walk in the cancer center, I would literally just take a deep breath. Like, okay, just do it. Just go in, just get it done. Just go, just get it done. After chemo, we did do a surgery. Now, women usually have an option. You can do like what they call like a lumpectomy, where if you have one solid lump, if the the problem area is like more isolated, they can remove that part of your breast and then reconstruct it. Or in my case, it was kind of scattered around. So a full mastectomy was warranted, with an option to do a double mastectomy. Now, here's the thing for me. I was already on my way to getting a whole breast reduction. I was actually on my way to getting a whole mommy makeover. I was like ready for the whole thing, right? Like I was already planning all this. And then this happened. So I was just like, well, we just going to just do a double and then we going to get this whole thing reconstructed the way I wanted anyways. Just to be honest, and I already was like always heavy, like had heavier breasts. And so I was just like, man, give me a break real quick. And this is the mindset I was in the whole time.
Right.
Like, let me take a break. This is okay for me. That's what I opted to do. And then, so you have chemo, and then we did the surgery, and then radiation. Radiation was difficult because you have to go every single day. You cannot move. If a piece of hair even so much tickles your face, you cannot move your finger and do this. You can't touch anything. And it just seemed like I would never itch until I got to radiation, but you cannot move. You have to sit there. You cannot move, for it to be as effective as they need it to be. And then the next part of the treatment, and sometimes doctors will put you on hormone therapies. There are some women who have more aggressive forms of breast cancer than others. And some women have breast cancers that are like more so hormone driven, like by estrogen. And that's kind of like what mine was. So they try to put you on a hormone therapy that suppresses that, so that it doesn't mean that 100% like it's going to like not come back, but it's a really good treatment where the outcomes are good for it not to happen again by keeping you on this treatment.
I have a question though. So
yes.
You're saying, you did chemo, you did radiation, and you also did the mastectomy.
Surgery.
You did both bilateral mastectomy.
Yes.
Double mastectomy. So, and that's big, because we look as women as our breasts being a source of our identity, right? As being a woman.
Oh yeah.
So take us a little bit about because then we'll talk about the physical therapy part right after that.
Right.
And that's the emotional component. Like, what did you deal with after having the procedure? How were you after that?
Honestly, I didn't know how I was going to be. Losing two things, temporarily that identifies you, as a woman, and feeling beautiful and feeling like these are your hair, and your breasts, some women, their butt, whatever. Right. But in my case, I'm like, losing two things, but I think I just tried to keep a positive mindset about the entire thing. It was a little emotional to lose something that I was teased about all in middle school, had every nickname in the book, because like I said, I was an early bloomer. So it was always a joke around my breasts anyway. So to temporarily lose something like that, it was a little different, right? Because it's just like, it was a part of me. But to be honest, I can't say like I was happy about it, but emotionally, I think I just tried to keep at the forefront of my mind that this is just temporary. It's not like it's forever. And I think after I kind of gathered myself, I don't remember where I was, but somebody tried to talk to me, and I'm like, oh my God, guys clearly don't care about this, because it isn't stopping anybody from approaching me, and it doesn't. So
beautiful woman. Beautiful woman.
Thank you. But it's just, at first you think about all these crazy thoughts. Of course, these thoughts will get in your head, but it's just staying positive about it and just knowing that it's just temporary. It's just temporary. It's not forever. And there are some days that, I have to really, it's a mental thing. You just got to get past what you see temporarily for right now until, you get to where you want to be. So
I know I worked with a client, and you can catch a preview video of it, but it's her situation was she had a mastectomy, and then she ended up having reconstruction, but her feeling comfortable and receiving something that was kind of foreign to her was really different. So it was difficult for her to look at herself in the mirror and just
it is at first.
Right. Mm-hmm. So it's just, that's what I was asking. So it's temporary, but there's other ways that you can I'm not saying fix, because it's not a fix, but it's other ways to adapt to almost like a new normal. And I think the biggest thing is just, I know from a physical therapy standpoint, if a woman is coming and to have some form of reconstruction, sometimes it's the limitation of their arms. They can't lift their arms up that high,
Oh yeah.
or they have scar tissue from the procedure. So that's the things that we do in physical therapy, helping with the release of scar tissue if they're losing some form of like function. Because I know you're not to that point, but just for someone, when you go into the reconstruction, there may be some limitations, because after you're having the mastectomy, you're not supposed to lift your arms certain positions. You're not supposed to lift.
Right.
You range of motion, you lose that strength. And that's
You
where
do.
physical therapy comes in, to be able to get back to the everyday things. If you can't comb your hair, if you can't put your bra on, the things that we don't take for granted, but we don't realize how important it is. And it does, it does affect below the skirt, depending upon. But again, that's what physical therapy can help with. Now, what are some physicalities that you may have noticed after your treatments for yourself?
Definitely lifting so my right arm, I can lift it. I still have to be careful, but where the problem side, it's super hard for me to go all the way up, like lifting my arm. And I really didn't realize how bad it was until about 2 weeks ago. I went to pop one of my kids in the back seat. I can't remember what they were doing, but I went to stop or whatever. And I hurt my arm, like my whole shoulder. I was like, oh my God, I can't push my arm behind, like my back. And I was just reaching, and I was just like, oh my God, I hurt my shoulder. And I move around a lot for work. In fact, I'm out of town now for a project that I'm working on with one of my clients. And of course I try to check my bags, because lifting, my bags up and down in the airplane is something I'm used to doing. But I had to kind of tone that down, because I thought I was a champ not too long after a surgery, and went on another trip for work. And I was like, oh my God, I can't lift my arm. Can somebody help me? Because it was really bad. I thought I could do it, but that's when I realized I couldn't do it. My back will itch on the other side, and going back to scratch. And I'm like, oh my God. And sometimes that, to me, the more emotional part of it are those things, when I realize it's small things that I'm used to doing that I cannot do. So even just like washing your back. So like I use the, whatever you call the little brush, and I have to use it with this arm, because I can't do it with this arm. But I don't realize these things until like I go to do it, like my back itching, or like I said, I went to go pop one of my kids. I can't remember what they were doing, and I can get my arm back. So those, to me, the more emotional part are the limitations that I discover along the way.
And I heard you mentioned, when we just kind of chit-chatted before this, you were just saying, even just trying to hug your kids or trying to pick up your kids, you realize at that very moment that you couldn't quite do some of those things. So it's really, you don't realize what you can't do until little things happen that you're not able to do. So again, those are different things that, physical therapy can assist with. And women need to know that. But I think the biggest take home from all of this is just being proactive and being aware of what's going on. And sometimes you can do the best you can. Like you said, you were doing your self checks for yourself, but yours was a different situation. You had that leakage. So what are some of your next steps now at this point?
So like I told y'all, before I even found this out, I was like all excited about my mommy makeover. Now I have to get the mommy makeover. Just talking to my doctor, being 31, they give you options. They really don't encourage breast implants in younger patients, simply because with breast implants, they over time deflate, crack. They do all types of different things. They look good, right? But they do different things. And then you just end up in there for another surgery anyways. So the option that they try to give the younger patients is actually using your own fat tissue, your own fat, and moving it to the breast to actually rebuild and reconstruct it where they feel and look like regular breasts. And in the process of all that, you get a tummy tuck and you get like sucked together perfectly. I'm not complaining, not a bit about that part. So they'll take it from my lower belly, tummy tuck, they tighten you up. Then they bring the excess fat, not all of it, I guess, however, whatever size you want to be, and they will bring that up to the breast. So my next step is reconstruction. And I'm honestly, I'm just kind of feeling like myself again. I I'm meeting people. And I'm just embracing, this journey. That was one of the first things I said. I went back into the dressing room after my appointment, after the mammogram. And I remember looking in the mirror and I said, God, well, whatever you're doing, I guess I'll just go along for the ride. I can take the heat. I don't even understand this, but if it's for me or somebody else, like, I'm just going to enjoy the ride while whatever it is we're supposed to be doing here. I'm in.
I'll commend you because I've seen you, watching from afar, but still being close. I watched how you dealt with things, right? You brought a positive outlook on it, and you pushed and you persevered. So just again, watching from an outsider in, you fought it. You did a good job. You're still doing a good job. And just you coming here being transparent about your story in the midst. You went through a lot. You had 3 children. You are single, going through a divorce. You're a business owner. You did a lot. And you're still doing it. So it just shows you, to any woman that's going through breast cancer right now, or if you know that someone that is, definitely share this information. Look at Candace, look at her story, because it just shows you it's not easy, but it can be done. And you
can be done.
It can be done. So what is, from this point, what would you speak from a mental standpoint, healing standpoint? If someone is going through what they're going through, what would you say to them? Because only you can relate to them. I can bring someone on, but I can't relate because I'm not in that shoe. She's talking to you, Candace, and she's looking at you. What would you tell her?
See the end, even at the beginning of your journey. Like, you have to see the end, and you have to literally see the outcome that God has for you. Like, when I found out about this, I knew at that very moment that I would come out okay. I already knew it. And so I would also say that not only did I discover that it's all in the attitude, I can't say 100% of it, but I feel 80% of it is mental, as much of it is medical, right? Keep a positive mindset. That is really not easy for a lot of people to do. And I know it's really easy for me to say, stay positive, because there's many things that will present itself to us just in life in general, where it's really easy to be negative. It's easy to be negative. It's hard to be positive. But if you just keep a positive outlook on everything and understand and see the end before anything even happens, you shape the world that you want to walk through. And that's what I did. Every morning I saw what my day would go like. Even one day during chemo treatments, I couldn't even walk. Well, that's fine. You know what I did? I took a chair, one of my office chairs, and I rolled around in the house. I made
Come on.
Eggs and toast. They didn't get a whole breakfast that day, but they got something, because there were some days I woke up and I could barely walk. And so you just have to try your best to be positive, and thank God that even if he spares you another day, that you have another day, one more day that somebody else did not get, another day that's not promised to any of us. There are people out here who get in car accidents every day. It's not just breast cancer. It's all types of things that present itself to us that could take our lives away. So are you just going to focus on this one thing, or are you going to focus on the life that God has granted you today? So that's what I would say. Just stay positive and be grateful for the fact that you're breathing now, and do something about it and make it count. So that's what I got for you.
Mike, you just dropped the mic. You just did. And I'm gonna put our website, our email, our contact information at renewalrc.com. I'm just going to be putting the chat right now, and a way you can communicate with us if you're needing physical therapy services after having breast cancer treatment. But what you said, it really runs along with what I live by, specifically when you walk into the office at Renewal. And if you've ever been there, it says the Martin Luther King quote, if you can't fly, then you run. If you can't run, what you do, you walk. If you can't walk, you crawl. But whatever you do, you just keep moving forward. And you painted every single one of those pictures. You went into the point where in chemo, when you were home, you couldn't walk, but you got in a chair and you rolled. So it doesn't matter how you do. You just keep on moving forward. And again, you can go to renewalrc.com for our website to be able to get more information. Is there anything else you would like to share with them, Candace? And before I thank you and go through all of that good stuff.
I can tell you this much. Physical therapy at Renewal is amazing. I literally leave and I'm like, oh my God, I feel like I just did a whole workout. Like it's intense, but it's amazing. Like it really does challenge you to that next level. Like you really start doing things. I'm doing stuff. I'm like, oh, I didn't even know I could do that. Okay. So it's amazing. I love it. I literally look forward to our sessions. So seriously.
Thank you, Candace. Thank you.
Yes,
Thank you. Thank you. And then
absolutely.
share a little bit with them, because I know with you being a business owner, what do you do?
I own a digital marketing agency. And so I do consultations as well, of course, for small business owners. And I do a lot of that. I'm traveling around and we do special projects. We do all types of different things, but just not to get into it. But it's a fun job. But
What's your company's name, and where can they find you?
Oh, Cohen Brand Management is our company name. And you can always visit our website, cohenbrandmanagement.com. Or you can look us up on Facebook. I also coach women and men because they join our crew too. Candace Cohen Coaching, Girl Go Hustle. So check us out.
There you go. There you go. But Candace, like again, I take this as an honor for you being able to come be with me on Below the Skirt with Tamara, and to be able to share your story, because you may not realize, if you just touch one woman, if you just change their mindset, if you just show them, hey, there's other ways to look at this. Yes, this may be a storm, but yes, through the storm you can come out and look. You're beautiful now, and you always have been. But just to see that beam and just you standing and being bold to share your story it's even a beautiful picture. So I wish you the best. And because you said it, because I respect patient privacy, and I look forward to continue to work and be a part of your journey as you live your best life above and below the skirt. And thank you everyone for tuning in. If you have any questions, again, you can go to our website at renewalrsc.com, or you can go for me at belowtheskirtwithtamara.com and share this with any woman that you know. And again, we're celebrating Breast Cancer Awareness Month, but Breast Cancer Awareness Month is not just today, it's not just the month of October, it is every day. So every day, be mindful, keep your eyes open. If there's something that does not seem right, you take the next step, because you are your biggest advocate. And that's what Candace showed you. She was not satisfied with what she was told, and she just kept pressing. So, and with her pressing, she is going to be there for her children, which is the most important part. She's going to be there for herself, and she will be there to serve the community with her business and her talents. So thank you so much for y'all tuning in, and we look forward to seeing you very soon.
Bye-bye.